gonna go over your medical history. I'm just asking some questions just to go over. Are you having any dental pain or discomfort at this time?
Just my gums sometimes.
Some gums. Okay. And is there like a specific area
I guess just like the molars in the back.
in the molars?
Yeah.
Okay. Is it more on one side or is it just
More on my right side.
more on the right? Have you had any complications associated with previous dental treatment?
No, not that I remember.
What was the date of your last dental visit?
It was between like somewhere in March of 2019,
Okay.
so it's been a while.
And do you know what clinic was that?
It was actually here.
It was here?
Yeah,
Okay,
it was here.
Awesome. Let's see. And then, do you have any swelling or sores in your mouth as of right now?
As of right now, no.
Do you have a dry mouth?
Sometimes I do.
Yes. Do you know what can lead to it?
Yeah. I don't.
No? Okay. How stressful are dental appointments for you? Are they like none, slight, moderate, extreme,
Let's say moderate.
moderate?
Yeah.
Okay. And what is there like a specific cause for that? Like, is there anything that triggers the anxiety?
No, it's just kind of more so fitting it in my time schedule.
Okay. So when would like dental appointments most likely work better for you? Like morning, afternoon?
I guess afternoons for sure.
Afternoons?
Yeah.
Are you under a physician's care now or within the last 2 years?
No.
No. And do you know the date of your last physical examination?
Yeah, it's been a long time, like
About
4 or 5 years ago, maybe. Yeah.
And by any chance, do you know the doctor's name?
I do not. I don't remember. It's been so long.
Have you ever been hospitalized or had any major operations?
No. No.
Have you had any serious head or neck injuries?
No.
Have you ever taken Fen-Phen or Redux, which are like medications?
Not that I'm aware of, no.
Have you ever taken Fosamax, Boniva, Actinol, or any other medications containing biphosphonates?
No.
And then, are you on a special diet?
No.
Do you eat a well-balanced diet?
I did.
Okay, what does that look like to you?
2 to 3 times a day. Well, yeah. Maybe skip a meal, so 2 times a day.
Okay. And what type of foods do you incorporate in your meals?
You know,
Like, is it mostly like
I mean-
herbs, fruits, vegetables?
yeah, for the most part, it's all in the, fruits, vegetables, breads. I would say less vegetables, but
Okay. And how is your water intake?
I probably drink about like half a gallon of water every day.
Okay. And is there like any changes you're like willing to make with your
I guess
diet?
have a even more well balanced diet, and then just maybe drink more water.
Okay. Have you experienced any recent weight changes?
Not in the last couple months, no.
And do you have issues with frequent urination?
No.
Do you have swelling glands in your neck?
No.
Do you use tobacco or marijuana?
I use tobacco sometimes. Yeah.
And how often would you say?
I would say maybe like a pack every 2 weeks.
Okay. And how long have you been smoking?
Maybe since I was like, I don't know, 16, 17.
So, do you use any controlled substances?
No.
Is there anything you feel may cause you to be more at risk for infectious diseases?
No.
And then, do you have any allergies, like including fluoride, local anesthetics, aspirin, food, or nuts?
No, no allergies.
And then, are you taken any medications like antibiotics or sulfa drugs? Any anticoagulants like blood thinners?
No.
Corticosteroids?
No.
Any insulin or other diabetic drugs?
No.
Nitroglycerin?
No.
Any pain medication?
No.
Prescription medication?
No. No prescription.
Herbal, vitamin, or dietary supplements?
No. No. No.
Over-the-counter medication?
No.
Any other drugs, vitamins, or supplements that are not listed above?
No.
And then here I have like a long list of health conditions that include like angina pectoris, heart attack, asthma, HIV/AIDS. If there's one that you think that you have, please let me know.
Okay. I guess maybe sometimes. I guess high blood pressure. And then after that, no, not any of those other ones.
Okay. And then for your high blood pressure, how long has it been since you realized? Did you get it? Were you diagnosed with high blood pressure?
Yeah, it was just maybe a few years ago, just after an incident, I went to the hospital and that's where they just kind of diagnosed it.
Okay. And are you still currently seeing your health physician?
It's been a while. It's a little bit more controlled, but at the same time, seeing them every, I guess, few months just to kind of check up.
Okay, sounds good. And they didn't prescribe any like medications?
They did, but I don't recall the name of them actually.
Okay. And are you currently taking them or?
No.
So I would recommend to visit your physician again just to recheck on your blood pressure to make sure it's like still controlled, to make sure it's not too elevated or it gets like out of control. I'm gonna take your blood pressure just to make sure it's.
Okay. You need me to take my pressure out? Or
I think that's fine.
Okay.
Face your palm up. You know how to rest it on the palm. So it is slightly elevated. So like I mentioned before, just like revisiting your physician to make sure they don't need to take your medications or like they want to prescribe you a new medication.
Okay.
Just to make sure all that's.
Yeah, I'll be sure to go and take it.
So looking back at my video, I would give myself 5 points for competency in professionalism as I exhibited a professional appearance, tone, and attitude. My body language was also confident and appropriate as I did face my patient while he spoke to me, made sure I wasn't just typing on the computer. I made sure to face my whole body towards him to make sure that he was being listened to. And there's also an appropriate space between me and the patient, the patient. Ethical considerations. We did get a consent for the video and photograph that was recorded. We did a media release form on EagleSoft to make sure we got his consent for it. Then I would give myself 3 points for novice in individualized care and questioning. I did some effective communication. I felt like I could have gone more into depth and gone into detail with the patient about what it is I'm asking and why I'm asking. I did kind of like a brief review of the medical history, and I kind of left out some questions that I could have asked more into like his hypertension and like with his smoking. I could have further explained to my patient what is needed to provide like for him to understand the need for the information. I think I could have done a better job on explaining how it links up to his oral health, and that's the reason why I'm asking all of these questions, and they'll give him a better understanding of how his overall health and what he does or what like conditions he has relates to his oral health. Okay, so I also give myself 3 points of novice for mastery of subject matter, as I did exhibit some understanding of the client's condition. Some questions were not asked, like I mentioned before, that will provide key information for the client's status. Like for example, I could have asked, what hypertension stage was he diagnosed with? When he got diagnosed, what year he got diagnosed? And so he monitored his blood pressure since then, and more stuff like that. Several closed-ended questions were asked instead of open-ended questions, which I think I could have done a better job of. Asking open-ended questions, as they will lead to to be given more further information from the patient. I believe I could have asked a lot more questions relevant to his condition and to the smoking as well.